Regarding my background, I did grow up here in Omaha, Nebraska, did undergraduate training at the University of Nebraska in Lincoln, went on to medical school at the University of Nebraska Medical Center. This was followed by graduation at Baylor University Medical Center in Dallas, Texas, and thereafter did a spine fellowship in Southern California at Lagituda Spine and Sports. I've always viewed getting into medicine or becoming a physician as a calling. Certainly there are many parts to being a physician that you have to ultimately be dedicated to on many levels, and that begins just with the desire to care for other people. You realize the world's bigger than yourself. You realize there's people that have injuries and problems that need attention and need a critical eye and don't just need a cursory type of care. Medicine is something that's unique in the fact that you get to see all parts of a person. You get to see their physical, their emotional, their social, their mental status, and you're in a unique place to speak into their lives as individuals, but also physically to help them to have a quality of life and a good function in their life. So I think for me, getting into the end of medicine that I've chosen in physiatry very much links up with that because we desire to maximize function in a patient. Physiatry is a very interesting field. Physical medicine and rehabilitation is the common term used. Physiatry is often confused with physical therapy or psychiatry, but what a physiatrist does is seeks to maximize the function of a person. So a physiatrist is an expert in muscle, bone, and nerve pathology and the overall function of the body. When people come to a physiatrist, they're looking for how they can feel better about their pain or sometimes a muscle ache or a bone problem. If I was to ask myself, do I have an area of specialty? For me, it's making sure that a person has an understanding of their diagnosis, and that takes a lot of parts. That's teaching and education and helping them understand the anatomy. One unique aspect of our practice on the technological side is that a patient can come into an individual room and we have screens available to immediately review an MRI they have just had completed and or a high definition CT and or x-rays that have been completed simply just down the hall, and these are very high quality, much better than you'll find anywhere else. Additionally, we have grown to the point of being able to virtualize our electronic health record, so this can be viewable for providers in any of the locations that we practice at. This makes it very easy for us to make an answer to an answering service on call and to give the patient the best treatment because we have the data immediately available to us, whether it's on a tablet, a cell phone. So that's been a growing part of our practice, and it's not perfect yet, but we're definitely advancing in that area. The thing I like about Nebraska Spine and Pain Center is that I love working here. I like the doctors I work with, I like the staff I work with, and honestly I look forward to coming to see patients. People come in to see us and are hoping to get better, and that's what we want to help people do, is get back to living. We really care about helping someone do the things they enjoy in life, and whether that's their hobbies, their work, or whatever it is that makes them excited, and so we look forward to taking care of those people here. Education and empowerment are a big part of helping people regain their life. We look forward to helping people get back to living.